Good evening. Today we are going to study cardiology MCQ challenge. Cardiology has a lot of weightage in the Neet PG exam and the INACT exam. So let us begin with the first question. Number one, a 25-year-old male presented with growth in the left atrium. What is the diagnosis? Just look at the image and think about the diagnosis even before looking at the options. Now let us look at the options. A. Rhabdomyoma. B. Myxoma. C. Metastasis. D. Papillary elastosis. Well, you can see from the image, it is a myxoma. Myxoma. It is a myxoma. So the correct option here is myxoma. Atrial myxoma is a very important topic from the NEET PG entrance point of view and INSCT point of view also. You can click the link in the description box to join my 2-day ultimate NEET PG rapid revision masterclass. It will help you a lot. So please click the link in the description box. A 45-year-old male presented with pulseless disease on examination following histological finding will be seen. Well, you can see here it is a granulomatosis vasculitis. Let us look at the options. A. Granulomatosis vasculitis. B. Fibrinoid necrosis. C. leukocytoclastic vasculitis. D. thromboangiitis optica. It is granulomatosis vasculitis. A 15-year-old boy presented with pancreatitis on myocardial biopsy following finding was seen. The diagnosis is, well, it is an Aschardt nodule. Why Aschardt nodule? Aschardt nodule is very important. What are here you can see the Aschardt nodules. The correct option here is Aschardt nodule. Factor responsible for cardiac hypertrophy is A. ANF, B. TNF alpha, C. CMYC, D. TGF beta. It is CMYC. Bulky friable vegetations are seen in A. Rheumatic carditis, B. Infective endocarditis, C. Liebman-Sack endocarditis, D. Non-bacterial thrombotic endocarditis. It is infective endocarditis where you see bulky vegetations, bulky friable vegetations. Heart begins to beat in which week? Heart begins to beat in which week? A. 4 weeks, B. 5 weeks, C. 6 weeks, D. 7 weeks. It is 4 weeks. Heart begins to beat by day 22 post ovulation and can be detected by Doppler ultrasound. It is week 4 post ovulation or fertilization and week 6 from the last menstrual period. So it is heart begins to beat in week 4. Absence of conotruncal septum gives rise to A. Tetralogy of Fallot, B. Patent access arteriosis, C. Transposition of great vessels, D. Coarctation of aorta. It is patent ductus arteriosus. Absence of aorta, pulmonary septum, AP septum leads to persistent or patent truncus arteriosus. Conotruncal septum is another name of AP septum. So it is patent truncus arteriosus. While measuring blood pressure of a cardiac tamponade patient, what advice will you give? What advice will you give? Whether to hold the breath or to breathe normally, or long and deep breathing, or short and shallow breathing. So, pulses paradoxes measurement. To measure pulses paradoxes, a manually operated sphygmomanometer is employed for blood pressure measurement in standard fashion, except that the cuff is deflated more slowly than usual. During deflation, the first cortical sound are audible, with heartbeats occurring only during expiration. With further cuff deflation, cortical sound become audible on all heartbeats throughout the respiratory cycle. The difference between the systolic pressure at which the first cortical sound are heard during expiration and the pressure at which they are heard throughout the respiratory cycle quantifies pulses paradoxes. So, since the depth of respiration influences the severity, the patient should not be instructed to change his breathing pattern during this evaluation. So, the correct answer here is breathe normally. Click the link in the description box to join the ultimate Neet PG Masterclass Blueprint. Name syndrome. What is name syndrome? Includes all: A. nevi, B. atrial myxoma, C. myxedema, D. affiliates. It is all except myxedema. Cardiomyopathy neutropenia syndrome is also called as A. Pompes disease, B. Barth syndrome, C. Holt-Oram syndrome, D. Fraser syndrome. Cardiomyopathy neutropenia syndrome. A. Pompes disease. Barth syndrome is widely regarded as rare X-linked genetic disease characterized by cardiomyopathy, skeletal myopathy, growth delay, neutropenia, increased urinary excretion of 3-methyl glutaconic acid, 3-MgCa. So it is Barth syndrome. Cardiomyopathy may be seen in all of the following, except alkaptonuria. Cardiomyopathy is seen in Duchenne muscular dystrophy, Friedreich's ataxia, type 3 glycogen storage disease. Causes of hypokalemic metabolic alkalosis with hypertension is Leader syndrome. Precapillary pulmonary hypertension is defined as PAP20. Which of the following should be the initial investigation in a patient with high likelihood of pulmonary embolism? Do D-dimer. A 30-year-old male presented with complaint of chest pain since 2 days to emergency room with following ECG. Identify the ECG. A. Left main occlusion. B. L6 occlusion. C. Acute pericarditis. D. Acute pulmonary embolism. What happens in acute pericarditis? In acute pericarditis, there is diffuse ST elevation in all leads except AVR and V1. ST segment is cored upwards and PR segment is depressed. T wave inversion with or without ST segment depression. ECG recognition of acute pericarditis, diffuse ST elevation in all leads except AVR and V1. ST segment is cored upward and PR segment is depressed. T wave inversion is with or without ST segment depression. The correct answer here is acute pericarditis. Identify the condition given in the image. A. PSVT. B. Sinus rhythm. C. Atrial fibrillation. D. Ventricular tachycardia. Well, it is atrial fibrillation. What is the most likely diagnosis of the following ECG? A. Ventricular bigeminy. B. Electrical alternance. C. P. Pulmonary. D. Improper calibration. It is ventricular bigeminy. Sustained VT is defined as that persists at 30 seconds. Identify the following ECG. AVNRT, atrial fibrillation with WPW. C. Atrial fibrillation all over. It is AVNRT. Well, this is second degree Momich type 1 block. Please comment in the comment box. Which of the following murmur increase with standing? It is HOC, hypertrophic obstructive cardiomyopathy. Which of the following antiarrhythmic drug can cause ocular changes? Well, it is amiodarone. Which of the following drug is contraindicated in a patient with given colon? It is captopril is contraindicated. Dofetilide is class 3.